Hello, doctor.
Hi, Muskaan. How are you doing?
I'm good. How are you?
Good, good, very good. Thank you. Thanks for having me on this live. Looking
Well,
forward to
thank
it.
you. Yeah,
How's your day?
it's good. I've been busy packing. I'm
Yeah, you
flying out
mentioned.
tomorrow. Yeah,
Wow. After how long?
after 3 months.
3 months. Okay. So I guess
Yeah,
you're missing back home, right?
yeah. It was like a little too much.
Yeah. But a successful trip, I hear.
Yeah, it was good. Got the GMC registration, got done with the attachment, got a couple of interviews here. So all in all, it was good. Yeah. So I think everyone already knows you, but just in case anyone here doesn't know you, this is Dr. Arora. He's a certified GP in the UK, and he is extremely interested in teaching. He has his own courses on PLAB 1, PLAB 2, MSRA, and even the GP exam. So if anyone's interested, you can check out his website.
Thanks. Thanks. Yeah, I've been a GP, as you said, for a number of years now, and now we're full-time in medical education. My passion, my 24/7, 365 passion is medical education, and not just helping guys get through their exams. Well, that's a big part of what we do, but trying to help people reach their potential. There's so much potential within
Yeah.
doctors, particularly IMG doctors from abroad, and we just try and make that journey a bit smoother, and if we can help in any way, then that's what we try and do. And exams obviously is a part of that, and
Yeah.
lab 2 is obviously a big part of what we do.
Yeah. A lot of people look up to you, for the courses and how you've helped a lot of people. So
Thank
that's really commendable. Yeah.
Thank you. That's really kind. And I didn't initially set off thinking about teaching for PLAB 2. I used to be a PLAB 2
Hmm.
examiner for the GMC. That's how I got
Yeah.
into PLAB 2. And I used to sit on the other side of the examining stations and kind of think, you know what, I feel sorry for some of these guys who are coming through and saying things that are not really helping them pass these
Yeah.
stations. And they're clearly things that they've been taught, and they're putting trust into people who are telling them to go and say these things. And
Hmm.
that's why I started thought, you know what, I want to go to the other side, and I want to try and help some of these guys, give some confidence back, and tell
Yeah.
them, you're good enough at what you're doing. You don't need to be a different doctor for this exam. And that's when I
Hmm.
stopped being an examiner and came across to the teaching and training side. So yeah, I've seen a lot of doctors prepare for PLAB 2, both on the examining side of things, but also on the teaching side of things as well. And hopefully we help in trying to bust a few myths, I think, that are
Yeah.
out there when it comes to PLAB 2, and give
Yeah.
people a bit of confidence back, I think.
Yeah. I think you just mentioned, a lot of people have been told to say a couple of lines or like phrases. I feel that's one of the things even I've heard from even my friends, they've been told like, use XYZ phrases, and that just like they lose themselves, like the way they are, or their uniqueness is not visible to the examiner. And that's one thing even I felt with a lot of people I used to practice with. And that's when I realized, that just doing the scripts is not everything. You really have to practice. You have to be yourself. And I felt like that was the main thing that helped me pass the exam.
Yeah, I agree with you. Like, people who are doing PLAB 2 are doctors, the
Yeah,
people have been seeing patients for years, whether through medical school or even when they've been working. They've seen thousands of patients. People
yeah,
have developed a style. People have, dealt with situations in the past. People have dealt with angry patients, upset
yeah,
patients, embarrassed patients, crying patients. People know how to deal with acute situations. It's just something that's ingrained. But then when it comes around to PLAB 2, they kind of think, well, I need to be a certain, this is not the right type of doctor to be. I have to be
mm,
this type of doctor. And that's where these stock phrases come in, because
yeah,
if someone's angry, then say this. If someone's embarrassed, then say this. And when you hear these things,
yeah,
the words, okay, might be reasonable, but the
mm,
whole way that it comes out doesn't sound right, because you're saying it for the 10th or 11th time
yeah,
versus the 10,000th time that
yeah,
you've been saying all the other lines that you've been doing in your career. So that's really frustrating. And set lines and scripts and things, you know in the old PLAB 2, where it was more of a situation-based exam where you have 5 minutes to do a very short part of a task,
mm,
you could in theory have that method where you learned scripts, You learn what
Okay.
to say. Whereas now when PLAB 2 is basically you're put in a situation, you've got to assess a situation and then take the story forward. That doesn't work. Stock phrases don't work. And it's just really a shame when I see this. Practicing people do a lot of mocks and things, and we see people
Yeah.
saying these lines, and that's one of the things that we try and change, and give people that confidence back and say, look, you know what you're doing. Why are you trying to be a different doctor? It's not helping you. In fact, it's making the person behind you watching or listening think that, this person doesn't really know what they're doing. They've never said these lines before in their life. And the moment that doubt comes in, you start, all those other doubts creep in as when you're looking and watching something. So that's why we spend a lot of time saying, yes, go through material, look at lines that are suggested, but don't think this is the line I have to say in this situation. Because, the way one person shows empathy, for example, is very different to the way another person shows empathy. But the way you do it is honed over years of doing this. So you have to trust yourself. And one of the biggest mistakes, I think, is that people don't trust their own ability in PLAB 2. And that's through a combination of rumors that go around that I've heard other people say lots of times. It's a combination of people telling them that this is not what you do, this is what you should do. And, that's just really sad to see from my side. And that's why we spend a lot of time trying to hammer these things out, of people's practice, I guess.
Yeah. Yeah, that's correct. So, Doctor, like, according to you, what would, like, because you've been on the other side and you've been like an examiner, you've seen a lot of people giving their exams and you've seen the mistakes they've made. What's the most common mistake you think people can work on, except for, of course, not following the stock phrases?
Well, I think passing PLAB 2 starts with self-belief, and I see so many doctors just start the whole process without belief. They've got through PLAB 1. PLAB 1 is an exam where you can sit and learn and get through it. Do the work and you get through it. PLAB 2 then becomes this brick wall, and it's like, well, I've seen all my friends, they may have failed, and people have spent lots of money and gone to all these courses and still failed. How am I going to pass? And you can see that in somebody, both when they're practicing, but also when they're in the exam setting as well. So the first thing you just got to keep telling yourself is that, I have the abilities to pass this exam. I have the skills to pass this exam. I have the experience to pass this exam. No exam has stopped me so far. Why is this exam going to stop me? So one of the biggest mistakes that I see is not a technical thing. It's not how people prepare. It's just up here. People have already sometimes decided that there's too many things against me, and I'm not gonna. I'll try it. Let's see what happens. If it works, it works. And that's the biggest mistake. You've just got to start from the position of, I'm good enough to pass. And it's like any exam, I need to understand a little bit about what's being assessed, and then I've got to tailor my preparation accordingly. As long as I do that, I'm fine. That's the biggest mistake that I see. The starting point is wrong, and the mindset is wrong. It's like, well, if it's meant to be, it's meant to be. That's not a way to go into an exam like this. And actually then when it comes down to the hard yards where you have to, do practice and get online and do role plays, if you're not thinking already that I'm able to pass this, then you'll find it harder to put the practice in, which leads you to more failing. So that's the biggest mistake, I would say. Before any of the technical stuff come in, before any of the courses, the teaching, the practice, you just mindset right and say, this is an exam and I'm good enough. And yes, it's a different country, and yes, there are sacrifices that I'm making, and yes, it's scary, and yes, it's a massive deal to go to another country that I've never been to before and try and do an exam. But thousands and thousands and thousands of doctors have done this before me. There's no way that they're all better than me. So I should be fine. And that is, I think, fundamental. Once you've hit that bit and you're confident in your ability, then the rest should be a lot more straightforward. So that's the biggest thing I'd say, getting your mindset right at the start.
Also, one of the common mistakes I, found in a lot of people, like even my friends practicing, a lot of people end up just reading the scripts instead of actually practicing and doing the role plays. I felt people, especially in the beginning, never realized the importance of practicing the stations, and they ended up just like reading the scripts, and they kept like a theory, like how people just study for PLAB 1. And I think by the end of it, I think before mocks or just before the exam, they would realize that, oh, I should have just practiced more stations.
Yeah,
Or,
100%. I mean, PLAB 2 is not a verbal PLAB 1. And people often kind of say, well, I've just got to learn all the theory, learn all the questions, learn all the guidelines, learn all the management, and then I've just got to go and verbalize that in the exam. And if I do that, I'll pass. It's just not that type of exam. They've assessed your knowledge in PLAB 1, That's what PLAB 1 is for. They know, okay, now you've ticked that box. You've got enough
Mm.
knowledge up here now. Now I want to see how do you use that knowledge in a situation. And that situation includes much more than just the clinical stuff. So yeah, people do lots and lots of reading and lots of prep, not just reading scripts, but reading guidelines, reading,
Yeah.
so much stuff. And it's just it's an information overwhelm. And then they try and replicate all that information in 8 minutes. And
Yeah.
obviously that's impossible. There's so much going on in your head in the first place, so much that you think, I've got to say this. You lose that connection with the patient. So if you practice properly
Mm-hmm.
and the right way, because it's not just about doing thousands of role plays every day. You've
Of
got to
course.
understand a little bit about what's being assessed, etc. But if you practice from early, even if your knowledge is not as good as somebody else, you can still get a much better score than somebody else. So often you'll see, two people know exactly the same amount of stuff. One
Yeah.
person gets a much higher score, one person gets a lower score. It's not the level of knowledge that differentiates people in PLAB 2. It's how well are you able to assess a situation as a whole, not just the
Mm-hmm.
clinical, and then how do you manage the situation as a whole and not just the
Mm-hmm.
clinical. And that comes from practice for sure. Um,
Yeah.
that comes from practice. So I agree with you. People who just learn and try and pass that way, it's a much harder job. Um,
Yeah.
but then practice is important, but the right practice is important. And one thing that we do when we do our
Definitely.
mocks and on live courses, we push people in consultations because
Mm-hmm.
often you know what it's like. When you're practicing with your friends,
Yeah.
it's very nicey, like it's very just like
Yeah.
friendly, and you try to be angry as a role player, you just start laughing, like
Yeah.
it's not great. So what you end up doing is you practice all the medicine stuff. You practice
Yeah.
asking all the right questions, and then have I said the right management from a guideline point of view. But yet people don't practice situations. They don't practice the angry scenario. They don't practice the
Yeah.
embarrassed scenario. They don't practice the blasé patient, and then they get to the exam, and it's a big step up from the practice that they've been doing. And it's
Yeah.
like, whoa, where does all this emotion come from? I wasn't used to this in my practice.
Yeah.
And that's when it starts to get really difficult. So when you talk about practice, yes, you need to practice early. But another mistake that I see people doing a lot is they do a case-based practice approach. So they'll say,
Mm-hmm.
let's practice a diabetes case. Let's practice a
Yeah.
hypertension case. Let's practice a COPD case, thinking that it's that's important. And there are hundreds and hundreds of those. But
Yeah.
actually, what you really need to do is just practice probably 20 or 25 scenarios or situation types: young
Yeah.
person, angry person, home visit, telephone case, embarrassed patient. Because once you figure out how to deal with the scenario type, the
Mm-hmm.
medicine just slots in, right? If
Yeah.
you can handle an angry patient case, it doesn't matter whether it's hypertension, diabetes,
Yeah.
or asthma. It's the fact that you're managing that alongside the medicine. The medicine bit's the easy bit. And
Yeah.
that's where people struggle. They try and practice thousands of cases because you get these big wads of, case
Yeah.
lists and stuff, and people just read them, and there are like hundreds and hundreds and hundreds of cases in there. But
Yeah.
the problem with that approach is 3 words change a whole case. A different patient emotion changes the whole case. So practice, yes, but practice situations is much more important than practicing cases. And
Yeah.
that's, I think, a big mistake that people make. They walk into the exam thinking, I'll be fine because I've practiced all 700 cases. But then you're still going to get a case that you haven't, it's impossible
Yeah.
to cover every case because it's the type of exam where 3 words that a role player says changes the whole
Yeah.
game. So
Yeah.
situation-based practice is really, really important. And that's why when we do role plays, we push people into those discomfort zones because we don't want people to hit that situation for the first time in the exam.
Yeah.
We want people to have dealt with severe anger or severe pushing of a patient or someone who's just not talking. Like, because if you prepare for 6 months and you feel like you've done pretty well and you get to the exam and bang, the first case, people start shouting at you and banging desks,
Yeah.
it's going to throw you, isn't it? So
Yeah.
yeah, practice, yes, but think about, is the quality of practice actually up there?
Yeah.
Or am I just going through the motion?
Yeah, definitely.
Yeah,
This was, yeah, this is also something I had in my mind that a lot of people end up practicing with their friends.
yeah,
So that's something even I don't advise people because with when you're practicing with your friends, even with I think angry patient or you're dealing with any emotion, maybe if you have a timer for 7 minutes, 8 minutes, after 2 minutes, even if your friend is not performing well, after 2 minutes you're gonna crack and you're gonna tell the story, and that's just gonna make you know the whole situation very easy, and then your friend's gonna think that, oh, maybe, the simulator's gonna like break up, and they're gonna speak maybe after 2-3 minutes. But that really doesn't happen, because even one station in my exam, the simulator didn't break till like probably 6.5 minutes. And
Yeah,
I
I
was
mean,
just like, what do I say?
yeah.
Yeah,
I mean, look, obviously I'm a previous examiner, so I can't talk about previous
yeah,
cases and things from an exam. But yes, if it's a situation where they're assessing your ability to deal with somebody who's not opening up, then you've got to have the skills to
yeah,
know how to get this person to open up. And if you
definitely.
haven't practiced that, and you're trying to figure it out in the heat of the moment when you're stressed and you're anxious in the middle of an exam and you're thinking, oh gosh, 6 minutes have gone and nothing's happened,
Yeah,
it's really, really stressful. And you're right, in a friendly environment,
yeah,
things might just come, and then you don't learn how to do it.
yeah,
And then you're in the deep end because you're facing something for the first time in the exam. And the one thing you don't want to do in PLAB 2 is find yourself in a situation that you've not dealt with before and
yeah.
understand how to deal with. And that's kind of how we base our teaching is, look, if you're in this situation,
Mm,
these are 3 or 4 things. It's not like these aren't the magic, it's not like these are the magic lines
yeah,
that are going to work, but these are the kind of things that you need to be thinking about to try and take that story forward into the next part of the case where you can actually get some data and you can actually,
yeah.
and that's where I think people um, struggle a lot, when they're
Mm,
okay in the straightforward cases, but then to be honest, everybody's okay in the straightforward case.
yeah,
Those aren't the differentiators. The
yeah,
differentiators are the ones that are the challenging cases, and then people don't get exposure to them enough, I think, and that causes
yeah.
stress, on the day itself,
Definitely. Yeah.
especially if it's your first case,
Hmm.
because we all know once one case goes down, it's really hard to stay
It's like,
strong, isn't it?
yeah,
In your mind.
yeah,
So that's a
uh,
big one for sure.
definitely. Also, like, I think a lot of people end up, if, like you mentioned, if one case doesn't go right, it just affects the other stations.
Yeah.
And that is something, we just have to learn how to not let one station affect the others, because, of course, if one gets affected, it's like in a row you're gonna not do well in probably 3-4. So what are like your tips on it? Because that's something even I struggled with, even till the day of the exam.
Yeah, I mean, firstly, there's no easy way to do it, but you need to figure out how to do it, because if you don't figure out how to do it, it's going to affect you on the day. And the PLAB 2 is you've taken a lot of time to practice. You want to make sure you're ready for those situations. So the first thing is almost you've got to expect this going to happen. People
Mm,
often go into the exam thinking, look, I really hope that every case goes well, and I really hope that I don't get
yeah,
a case that I don't know, and I really hope that I don't bomb a case. The first thing is you've got to switch that mindset to, you know what, I'm going to bomb a case.
yeah,
Like, it is going to happen. If you do that many cases in a row, it is
of course.
inevitable that 2 or 3 are going to go really poorly. So
Yeah,
the first thing is accepting that that's going to happen rather than hoping that it doesn't happen. Because if you hope it doesn't happen, then when it happens, you just go, oh, I can't believe it happened. Whereas if you just expect it, then if you bomb a case, you're like, okay, that was the one I bombed. It's fine. Like, it was
yeah,
going to happen. So that's the first thing. Expect it. But the second thing is you've almost got to make sure you've gone through that thing before. So a lot of people, they do lots of practice, yes, but they don't
mm,
practice back to back. That's
yeah,
so important. Even if you're just doing 3 cases back to back regularly, the fact that you might have bombed a case, but you've practiced moving on to the next case is really
mm,
important. So when we do our live sessions, we do mocks, proper
mm,
mocks, where you do 6 tough cases back to back. So we
okay,
know that you're going to bomb a case, and we
yeah,
want to prep you for then how do I get that out of my mind and move on to the next one? Because it's one thing for anyone can say, you know what, just forget about the last case, move on to the next one. Anybody can say that, like
yeah,
anyone can say those words. But you need to have been through it. You need to have practiced it. You need to understand that when this happens, this is how I'm going to get back on track, and
yeah, yeah,
almost prepare for that and think, you know what, if I have a bad case, these are the 3 things that I want to think about, so I get ready for the next case. These are the 3 things. Like, you've actually thought about maybe these 3 things are going to trigger me back into, rather than just think, you know what, I hope that when it happens, I'll be fine. Because
definitely.
you just can't walk into a high stakes exam like this having not practiced bombing a
Mm,
case.
yeah,
It's such an important thing, and that's why when we do practice with people, we always make sure that these are the 4 or 5 things you have to have prepared your brain for, so that you're
mm,
not trying to figure out in the heat of the moment, how do I deal with this? Because that's just too stressful, right? If you're trying to figure that
yeah,
out in the middle of an exam when you're super stressed as it is.
yeah. I was fortunate enough to have like my next station as a rest station after I bombed a case. So I was able to calm down. But of course, that's not the case with everyone.
Yeah, and you know, sometimes that's even worse. Like for some people, they find that harder because you've
Yeah.
suddenly got, you know, in 10 minutes to sit there and think about what happened. So for some people, that might be too much. That, you know, you're mulling over this case for
Yeah.
10 minutes. You obviously did really well. You managed to put out your mind and calm down and move
Yeah.
on. Whereas for some people, having that extra bit of time is super hard to deal with. So yeah, preparing for it in advance is important. And you know, that goes back to the theme that we always talk about. You do not want to approach any situation in that exam for the first time, whether
Yeah.
that's a type of scenario or whether it's something like bombing a case. You want to
Of
have
course.
been through it before. You want to know the pattern of how you feel so it's not going to surprise you.
Definitely.
And so yeah, a big mistake is that people do think they've practiced everything out there, but you've not practiced everything out there. You know, firstly, you
Yeah.
can't, but you need to practice stuff that perhaps is not taught like that.
Mhm.
You know, everyone teaches everybody what to do in a case of hypertension, but
Yeah.
no one really teaches you what to do when you just bombed a case. What are the strategies that you can do to get your brain back up?
Hmm.
You know, we talk about simple things like, you know, in those 2 minutes before a case, what are the 3 or 4 things that you should be hitting your
Yeah.
brain with so that you're at peak performance for when you start that case? People often don't really talk about that. You know, how do you
Yeah.
prep your mind in those 2 minutes? Because if
Yeah.
you don't have a strategy, you'll find yourself just thinking about the last case for most of that time.
Yeah.
And it's these things that, you know, it's, you know, 1 or 2 marks passes or fails PLAB too. And these
Definitely.
things are so crucial. And it often surprises me that people don't really focus on these things enough.
Hmm.
And, you know,
Yeah.
you see people who take the exam once, twice, 3 times. And it's really sad because, you know, they'll put a lot of effort into it first time and they'll fail, and then obviously they'll knock their confidence, and then
Yeah.
they'll think, you know what, I've got to work harder. So they'll do
Yeah.
even more work for the second time,
Yeah.
and they'll fail because they haven't really turned around those small things that make a big difference. They've just worked
Yeah.
harder. Doesn't mean that you know you're going to score more.
Yeah.
And then it gets the third time, and the patterns repeat, and you know, yeah, then it becomes a mindset thing because once you've not passed it,
Yeah.
obviously confidence is a big deal. And that's where we might come in and turn it all around and say, you know what, forget everything from the past. Obviously, what you've done is not helped you. Let's
Yeah.
split it down. And one thing we do a lot of is we try and keep things as simple as possible. I think with PLAB 2, it's
Yeah.
a very overcomplicated exam, or people
Yeah.
make it overcomplicated. It's actually very simple. You've got a situation in front of you. You've got to assess it from 3 viewpoints. We talk about the clinical, the mind, and the life viewpoint. And then
Yeah.
in the second half, you've got to basically take that story forward. You don't have to solve it. You don't have to
Yeah.
manage everything. You have to take that story forward in a safe way, thinking
Yeah.
about the medicine. And as long as you keep it as, you know, simple things, then I think it becomes much less of a burden in your mind. And the less you have to think about, the less you have to stress you, basically.
Yeah.
Uh,
That's true.
so, you know, I could go on for years about things that people, I think, do, mistakes that people make. Another one is they worry about the small things too much.
Yeah.
You know, they worry about stuff like, is my hands moving too much, or am I making too
Yeah.
much eye contact, or is my tone of voice good or not, or am I allowed to sit in this way or not? That stuff, you know, I just hear so much. People have been giving feedback, for example, that you know, you're making too much eye contact, and then
Yeah.
somebody else tells them you're not making enough eye contact, and then they just get super stressed that my eye contact is completely wrong and I don't know what I'm doing. And you just got to think, you know what, just calm down. You've been seeing
Yeah.
patients for years. If your eye contact was really that much of an issue, it would have come out
You
by
would,
now.
yeah.
Yeah. But these things just blow up in your mind, and then they take you away from the bare bones of what this exam is about,
Yeah.
assessing the situation and taking the story forward.
Yeah.
And so, you know, focusing on the small stuff rather than the bigger picture is a big mistake that I think people make.
Yeah.
They try and cover every angle, and it's impossible when you're having a one-to-one conversation with another human being. You can't
Yeah.
prepare for everything that's going to come your way because it's a human being on the other side, and they're going to respond to what you say rather than
Yeah.
what they, you know, and but yeah, these are the kind of things, like I said, that we try and really
Yeah.
focus on rather than say, okay, you need to learn these 17 questions for hypertension case, because that's
Yeah.
a bit that anybody can do, to be honest. Any book can teach you that. It's principles, strategies, how to simplify things. That's the kind of thing that I think in PLAB 2 really helps people.
Yeah. Yeah, even I have noticed this. A lot of people end up just worrying about the complicated management. Maybe like the surgery, they'll be like, oh, I forgot to mention the surgery. I didn't say this, I didn't say that. But when you ask them if they have symptomatically managed the patient, they were so just engrossed trying to remember which surgery they had to say that they forgot to even symptomatically manage the patient.
Yeah.
And of course, in those kind of stations, they end up failing because people just fixate on the smaller things rather than just managing the patient as a patient.
100%. And this is what I see, because people will send me a lot of like feedback grids and stuff, and
Yeah.
like, you fail, I like send you, can you have a look at this grid? And they're very stressed because the cases that they
Yeah.
think they did the best in, they end up getting the worst marks.
Yeah.
And the cases that they think that they bombed maybe or didn't do so well, they actually end up getting high scores. So people can't figure
Yeah.
this out. Like, why? I did really well in this case. I said everything. I said everything, the treatment, the surgical management, the complications. I said it all. What if I got 2 out of 4, 1 out of 4 in
Yeah.
management? And they don't understand that because what they've done is they've just gone in and within 30 seconds, I think, okay, I know this case. I know what
Yeah.
this is all about. And you blinker and you stop asking questions. You stop understanding other things about that case because you're already thinking about what you're going to say in management. And then when it gets to management, you just go off at 100 miles an hour. I've got 17 things I've got to say and I want to say them all.
Yeah.
So patient centeredness goes out the window. You don't talk about any other issues apart from the one that you think is the most important one. And you may do that bit really, really well, but there may only be 1 mark available for that.
Yeah.
And then, and that's why people struggle a lot. And in the cases that actually you think, you know what, I didn't think I did very well in because I didn't really know what was going on, you end up getting higher scores because when you don't know what's going on, you ask general questions
Yeah.
and then you understand more and you talk generally and rather than specifically and you score higher. So
Yeah.
it comes down to understanding how you're being assessed, understanding what the 3 domains are. For those of you who don't know, obviously data gathering, interpersonal, and management. But knowing what that means, data gathering doesn't mean
Yeah.
do a history. You're not being assessed on can you do a clinical history of back pain. That is data gathering is what data do I need to know to manage this situation? Now that data will include clinical history, but it also include data about their mind and their thinking.
Yeah.
It will also include data about how this back pain is causing issues in their life. And if you don't understand that, but you do a
Yeah.
perfect clinical history, you're not going to get 4 out of 4 in data gathering.
Yeah.
Similarly, in management, management is not about how do you manage non-specific back pain from a guideline point of view. Management is about how do I manage this situation in front of me, including the clinical stuff that I got to say, but also managing the fact that this guy's about to lose his job because he can't lift anything
Yeah.
because of his back pain, also managing the fact that this guy is worried that it might be TB of the spine, also managing the fact that he's drinking excess alcohol to help with the back pain.
Mm.
Now, if you're not demonstrating to somebody who's watching or listening that I,
Yeah.
as a clinician, understand that these are the things that I need to be managing,
Mm.
yes, you can't manage all 4 of those things in 3 minutes, but you can demonstrate that these are the 4 things that I think I need to be managing in this situation, and I'll probably have time to then manage one of them.
Yeah.
These kind of simple shifts in how you approach a 2 or 3 minute management plan can make a big difference.
Yeah.
But if you don't understand actually what are these 3 domains about and what skills am I supposed to be demonstrating to try and score well, then you will just learn every question about back pain and you will learn every bit of guideline about back pain and you will reel them off and you expect to
Yeah.
get 12 out of 12. And it
Yeah.
just doesn't work. And sadly, then what they do, they fail the exam and they'll think, okay, I didn't clearly know enough about back pain. So they'll go to the
Yeah.
next exam having learned double about back pain
Back
clinically.
pain.
And they'll say even more about clinical stuff and get an even lower score. And they can't figure this out. And
Yeah.
that's where we come in and say, you know what, look, let's go back to basics.
Mm.
You've got to think of it as a situation, not a condition. And all
Yeah.
these things that we talk about all the time on our courses and things. But the reason
Mm.
it's so important is we almost have to deconstruct the fact that they've learned all this stuff,
Yeah.
but that may not necessarily get you the higher scores.
Yeah.
And that sometimes takes hard work, when people
Yeah.
have been preparing for 6 months a certain way, and suddenly they're told that, you know what, this is nice, but it doesn't mean you need a high score. It's
Yeah.
hard for them to adjust, which is why we prefer to get them in the beginning, where we
Yeah.
can set the base right, and then when they practice, they're working on those kind of skills.
Yeah.
So a big mistake
Definitely.
is not understanding what data gathering means, what interpersonal means, and what management means, and just kind of doing what they assume it means, or
Mm.
maybe what they've been told it is, and then
Yeah.
wondering why you don't get the higher marks.
Mm. Yeah. Also, I think, doctor, one of the common mistakes I found, like, people now, like, they actually focus on IPS and they'll be like, listening to the patient and they'll be maybe asking the right questions and data gathering and asking for the right investigations. But by the time, the time's up, they're barely able to come to management. And then they're like, but I was listening to the patient. I wasn't interrupting the patient. I was going with the flow, but I couldn't reach management. So I should be getting good marks. But
Yeah.
when the result comes, they actually don't get any marks from management, and then they're clueless why I didn't get any marks because I was just good. My IPS was good, and everything was going right. I don't know what happened.
Yeah. No, it's a really good point. And there are two broad categories of people in terms of how they do their first half. There's the people who haven't really thought about IPS. They're thinking it's more a clinical exam, and they will just ask loads of questions.
Yeah,
And they will get through data gathering fairly quickly because there's no IPS there. It's just
yeah,
question, 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 question. So you have that type of person. And then you have the other type of person that you just talked about, which is the people who've been told, like, just, go with the flow and, just
yeah,
let the patient, handle everything or direct it all.
yeah,
So you may look really good empathetically and IPS might be really good, but it will take you 7 minutes to get the data and there will still be gaps, right?
yeah,
So what we talk about is you've got to have this middle ground. So we talk a lot about
mm,
bubbles, 3 bubbles. People know us
yeah,
know about 3 bubbles, red flags, psychosocial eyes. So
yeah,
you have in your mind 3 things that I need to achieve in data gathering, but they're bubbles so they can float around. So it's not like I have to do this first, then this second, then this third. So you kind of have that mix of everything. You've got a strategy. There are certain bits of information that I need to be covering,
yeah,
but you have the flexibility to allow a patient to go into one of them and you pick that one up first, for example, rather than thinking, I need to do this first, then this first, then this second. So
mm,
you have to have that balance. If you're too extreme on either side,
yeah,
then you're going to struggle. If you're too doctor-centered and don't even care about the patient in front of you, you're going to struggle. If you're completely patient-centered and don't even think
yeah.
about what I need to achieve as a clinician, you're going to
Then,
struggle. So these 3 bubbles help to kind of break that ice. So, again, these are simple strategies that make a big difference. But yes, you're right. We see 2
mm,
extremes, and often the extreme that you're in depends on the advice that you're given. So, for example, you might have been a very doctor-centered person, and then someone
mm,
comes along and says, you know what, you need to be a bit more relaxed. You need to let the patient
mm,
be a little bit more. So then they go to the other extreme completely. Or you might get
yeah,
somebody who's on that extreme, and someone says, you know what, you're wasting too much time. You need to ask
yeah,
more questions, and they go too far the other way. So it's always that balance of, yes, patient-centeredness, but you know what, you've got a job to do. You've
yeah,
got to gather data, but you've got to do it in a way that's alongside the patient. And that's where things like the bubbles that we talk about and the 3 R's, reflection, reasoning, relevance, these things all help to tie all that together so that
yeah,
you are achieving the things that you need to achieve. You're getting the data that you need, but it's not taking you 7-8 minutes to allow you, therefore, to manage it in the second half. And then even in the second half, it's things like, you know what, you've only got 3 minutes, but that's fine. It's plenty of time. Just use it wisely. Spend the first minute highlighting what you think is important about the case, demonstrate that these are the things that I think of, and then maybe jump into one thing like pain relief or investigations or referral or drugs or whatever,
mm,
management. But don't jump into one thing and get trapped
yeah,
before you've highlighted everything that's important. And that's where
yeah,
we talk a lot about issues on the table and the golden first minute management. And again, these are principles that don't take very long to teach somebody, but they can make a big difference in how your 8 minutes plays out, basically. And those things can make a difference between getting a scrape pass and getting into that kind of cushion pass, where that even if I mess up a case, it doesn't matter because I've got enough in the bank.
yeah,
If you're constantly on the borderline for every single case and then you bomb one case, then you're
yeah,
below the line. And you don't want that one bomb to have any impact on your overall score. You want enough in the bank. And
yeah,
again, when we teach people, that's the kind of stuff we do. How do you change 2s to 3s? How do you change 3s to 4s? By doing simple things, not just by demonstrating more knowledge,
yeah,
because that's not the way to do it. And sadly, a lot of perception about PLAB2 is that the more knowledge you demonstrate, the more you're going to score. And of course, there are some cases
yeah,
where it is pure medicine. Someone
yeah,
collapses in front of you, you have to demonstrate, I know what I'm doing. Like, there's no doubt about it. If this happened on a ward in 3 months' time and I'm a junior doctor, I know what I'm doing. Yes, some cases are going to be like that. But 90% of the cases, there's nothing acute about them. There's
yeah,
nothing emergency about them. so you have time to do it in a slightly different way, and that's where I think the difference can happen.
Yeah, that's right.
But mistakes, like I said, there are lots of mistakes that people make, I think, and one or two mistakes is not gonna fail you PLAB too.
Yeah.
It's when you're making 4 or 5 or 6 of these things happening together, then that 8 minutes becomes quite weak in terms of your ability to demonstrate enough to pass. And everyone has their own style. Everyone will make one or two mistakes. It's just human. You're a human being.
Yeah.
You're going to, particularly when you're stressed. But it's when you have that, it's that combination of things that sadly leads to a lot of people failing PLAB too, when they shouldn't do. These are good doctors. They know what they're doing.
Hmm.
They shouldn't be failing PLAB too. But unless you understand these simple things, it can sadly make a difference.
Yeah. Doctor, what would be your advice to people who have failed and right now are just struggling with confidence? And of course, if they fail like maybe one or two times, they're just like, they don't know how to crack the exam. They're just like, they were good and unfortunately they failed by probably one station or point 2, point 3 in the
Yeah.
overall score. Yeah.
Yeah, well, the first thing is there's two things to work on. There's the mindset to work on, and then there's the actual preparation for the next time, and they're two completely different things. And if one is sorted and the other isn't, then you need to get both sorted. So from a mindset point of view, it's hard, but it's about reminding. Look, there are thousands of people who failed PLAB 2 before, and thousands there who are now working in the NHS after having failed PLAB 2 once, twice, 3 times. So you're not the only one who's failed. You may feel like you're the only one. You may even be the only one in your friend group who's failed. But trust me, there are thousands of doctors who have failed PLAB 2 recently, just like you. That's the first thing. You're not alone. Secondly, it's a very passable exam, and small changes make a big difference. When you start preparing for an exam second time or third time, you're not starting at the beginning again. It's not like you have to go out at the basics and learn everything. You've
Yeah.
got a really strong base. You already
Mm.
know a lot of stuff. Now it's just about what are the few tweaks that I need to make that can push me above the line. So sometimes people think, oh, I've got to do all again. I spent 6 months preparing for this, and you're not gonna. You're already at 70%, 60%. You've just got to tidy up. That's the second thing. So it's not like you're repeating the whole thing again.
Yeah.
And thirdly, like I said, always small changes make a big difference. And in PLAB 2, you have not failed. You most likely have not failed because you've not done enough work. Some people do. Some people they don't do enough work, and they admit that. That's easy because they know that I didn't
Yeah.
put enough work into it. For them, that's easier to overcome. But a lot of people have done a lot of work already, and then they still fail. And it's just about reminding them that it's not about how hard you work. It's about just understanding what's being assessed, and that you can learn in 2 days.
Mm.
So and also just telling them, look, this may seem like a huge event right now in your life, but if you think you've got another 40 years ahead of you in your clinical career, this is a blip. Like it's on the big scale of things, it's a very small part of your career. And we talk about longitudinal and horizontal. So it's a blip in your longitudinal way. So you've got a lot of history behind you. You've got a lot of stuff ahead of you. In a few years, this will seem like a very insignificant event. So longitudinally, it's a very small thing. But also horizontally, yes, you failed an exam, but there's so much else in your life that you've got right now that is absolutely brilliant. Family, whatever, friends, whatever. This is a blip horizontally as well. It's just a small part. Right now, it's huge in your mind. But actually, when you put it in perspective, longitudinally, horizontally, it's a small blip. Small changes make a difference. There are thousands of doctors who've passed this exam before, second time, third time, or fourth time, and you'll be one of them. And I think allow yourself the space to almost go through the motion. And if it takes you 2 days, if it takes you 2 weeks, don't fight it. Just let it be. Accept that you're going to feel gutted for a while. You're a human being, but just realize that when you get through that and you're ready to go again, then you can do it. And it's not like you have to do it all again and start from scratch and etc. So those are the kind of things I would say. And a lot of people do contact me when they failed, and we obviously have lots of resources and teaching that we can help. But more than the resources and the teaching and the courses, it's more about getting their confidence back. And we spend a lot of time just doing that, really, because that's probably the biggest barrier for most people, I think, at that point.
Definitely.
So, but PLAB 2, and I do get it's a big deal. Coming across another country is not easy. PLAB 1 you may have taken at home.
Yeah.
It's not a big deal. But PLAB 2 coming across, a lot of sacrifices, and then to fail, I do understand how big a deal it can be, but it's not the end of your career, you know. And it's important to
Yeah.
keep telling yourself that. So if anyone's in that
Yeah.
position and you want to reach out, if you have failed, please do, because we deal with this on a day-to-day basis, and I'm sure we'll have things that can help.
Yeah. I'm sure um, anyone would benefit if, you know, they message you. And of course, you have been helping a lot of people, and whatever you do is just commendable. And your approach to PLAB 2 or the other exams, it's really good. And I've seen it's helped a lot of people. And even like the courses, the way, you know, you just hit on the right things, like you mentioned about the three bubbles, and even managing time. Maybe it's about understanding each and every aspect of what's being charged, be it data gathering, be it the clinical skills management. And it's really good. And you know, I think coming from an IMG perspective, we're glad that we have something like this that can help all of us, because when we're back anywhere, because I'm from India, so there are a lot of people giving this exam from all over the world. Uh, Everyone's just clueless. I think even when I started PLAB 2, I was just extremely clueless. I was just like, this exam's just so different. And I did see a lot of YouTube videos, but till the time I didn't practice the station, I just didn't know what to do and like how to go about it. So I think you know, your courses and everything, it's been a great help to IMG. So I would really like to thank you for helping out so many people, not
Thank
just,
you.
yeah.
Thank you. And you know what? That it turns around the other way as well. Like, we're always really grateful for people who put the trust in us, because
Yeah.
you know there's lots out there, and you guys are, you know, spending money and things, both for the exam, for travel, all this kind of stuff, and then to put your
Yeah.
faith and money into some of the stuff that we do. We're truly grateful. We love what we do, and you know, like I said, I remember being an examiner on the other side and just seeing, you know, just I used to felt bad when I was hearing these phrases that clearly the person
Yeah.
doesn't want to say, but thinks they have to say,
Yeah.
and not understanding, you know, what am I looking for from an assessor, not understanding
Yeah.
that, you know, and that's why we do what we do, and if it helps, you know, great, and I'm glad it does, and hopefully we'll keep doing it for a long time going forward. But it all comes back to the beginning. Like I said, you know, the biggest mistake that I see is lack of belief. And once you understand a little bit about what an exam's about, what's being assessed of you, what's my role in this 8 minutes, what am I actually, what are the skills that I'm supposed to demonstrate in this 8 minutes,
Yeah.
then once you understand that, then your belief starts to get there, and you start to realize, actually, this is an exam that I can pass. It's not some
Yeah.
crazy thing that no one understands, and everyone just flukes their way. It's an exam, and every exam has strategies. Every exam has systems that you should do. Every exam has a marking scheme. And you're right. When people start praying for PLAB 2, the first thing they'll start doing is opening up scripts, reading through masses of material, starting to go all over social media and say which is the best course to go to. That's the kind of starting point, where people don't really go back to the basics and look at what the exam's all about.
Yeah.
And if that's the kind of stuff that we can help them, then great. That's all we'll keep doing.
Yeah. I think we've already spoken about a lot of mistakes that people do in PLAB 2. Doctor, is there anything you like, any message you have for all the people who are still preparing for PLAB 2, or you know, they are on their journey, or they're done with their PLAB 2? Anything?
Well, yeah, if you're preparing for PLAB 2 right now, then it doesn't matter where, if you're at the beginning of the preparation, if your exam is tomorrow, you know, it's about keeping things simple. Like I said, I always talk about the more stuff you cram into your head, the more complexities you put in there, the more you try and achieve, the more things you're told you're supposed to do, just the more stressed you get. So sometimes stripping it down, really thinking about what is my job in these 8 minutes, and understanding that, and then working out a few principles around how to achieve those things, that will put you in a much better position, whether you're right at the beginning or whether your exam is, like I said, in a few days' time. So that's the first thing. If you just pass PLAB 2, then, you know, massive congratulations. And I know when you first pass PLAB 2, like when you're doing PLAB, it seems like, hey, this is the big thing. Once I've cleared PLAB 2, everything will be fine. And then you pass PLAB 2 and you think, okay, right, now I'm actually at the beginning of my journey. I've got all this
Yeah.
stuff to do. I've got to think about jobs. I've got to think about applications. I've got to think about what do I want to do in the future, MSRA and all this stuff. So, treat PLAB 2 like just any other stage that you've taken so far. Don't make it too big. Don't make it too small. It's another stage that you need to pass. And then realize that when you pass PLAB 2, the next stage is going to begin. So it's just not about putting it on too high a pedestal. Yes, it's a crazily stressful exam, but there are many more crazy stressful exams to come in your life. So if you passed it, it's just about thinking, celebrate it well because you deserve it. It's a big deal passing PLAB 2, and then just start thinking as quickly as you can about what's the next stage. Because again, like with anything, the more preparation, the more knowledge you have about the next steps coming up, the better you feel about it, the more comfortable you feel about it. So whether it's looking for jobs, whether it's what training, how do I get into my training specialty, what exams are coming up, just orientating yourself at every stage is an important thing. And as an IMG doctor, look for all the other support mechanisms out there as well. It's not just about what's the next exam and what's the next application and what's the next job, because coming to another country is not easy. There are many other things that you're going to have to deal with apart from forget the medicine, forget the job stuff. There's so many other things that you have to deal with, and just take the time to deal with those in just as much effort as you would deal with the exam part. Because if you let those things go and don't focus on that side of things, like friend networks and meeting people and staying in social contact with people and stuff like that, because I've seen people just go into their shell a little bit when they come into the UK, then it's going to affect every other part of what you do as well. So just yes, whatever stage you're at, think of the exams, yes, but exams are just one part of a vast array of things in your life, right? And especially as a new doctor in this country, it's not easy. And that's why we're here. That's why we don't just help for exams. We run network events, we run conferences for IMGs, because these are the kind of things that I think hopefully will help alongside the resources for the courses and the exams as well.
Definitely. So I think, Doctor, I've already taken a lot of your time. Thank you so much for sparing time and coming and talking. I'm sure this would help a lot of people.
Thank you. No, thanks for putting it out there, because like I said, there's a lot of rumors and myths about PLAB 2, and if I can help dismiss some of those things and get some confidence to people back then all great. But if people do want to reach out to me, please do. I'm basically on 24/7, 365. I'm happy to take messages at any time of the day, any time of the night. So please do, put all your stress on me and ask me any questions that you need to ask. And if you want to look at some of our resources, not just for PLAB 2, but PLAB 1 and MSRA, then have a look at the website, and I'm sure you'll find some details there. But yeah, hopefully we can help many of you at some stage in your career going forward.
Yeah. All right.
Awesome. Okay. But thank you so much. Everybody take care. Thanks for joining. And yeah, thanks
thank you
for sorting this IG Live out.
Thank you. Like Doctor mentioned, if you have any doubts, you can always contact him, and I'm sure that he would sort out everything.
And if you follow us and you haven't heard of Muskaan before, by the way, please do follow her, because the stuff she does for IMGs is amazing. So if you're new to her through this, then please give her a follow and show some support, because what she does, I think, is invaluable and is helping a lot of doctors out there around the world. So thanks.
Thank you. All right.
Cool. Take care. Thank you. Bye. And have a great trip in India as well.
Thank you.
Bye.
Bye.